A major reversal tonight from the Democratic governor of Michigan, because after a threat to doctors last week to not use the anti-malarial drug, or the drug also used for lupus and rheumatoid arthritis, to treat COVID-19 patients in the state is now requesting an emergency supply of the drug that we've been talking a lot about, hydroxychloroquine. And get this, hydroxychloroquine is rated now the most effective therapy by doctors, over 6,300 of them surveyed, for coronavirus, according to a brand new study. Now, also tonight, the FDA is authorizing a new virus test that actually identifies past infections. And a study out of the University of Pittsburgh is showing that early promise, as researchers are testing a potential vaccine on mice, found that it generates enough antibodies capable of fighting off the virus. Here to explain more, our medical aid team, Dr. Oz, is with us. Thank you again for being with us, Doctor. Let me first, apparently they just sent out an advisory in New York. I mean, the timeline for de Blasio is go out to bars. I mean, he's like saying it just a few weeks ago. It's insane. Now he's telling people just wear scarves. So is a scarf going to help you?
Well, a scarf's not going to be as good as a surgical mask, and that won't be as good as a N95 mask. But there's a rethinking around masks, in part because we realized that the virus doesn't go deep in your lungs. It probably inserts itself right at the very tip of your nose. And imagine little doors there, which are where the cells receptors can accept the virus. The virus is a key, and it unlocks those doors and goes in. Older people have more of those doors than younger people. That's why they get more of the infection, we believe. And wearing any kind of facial covering could block the larger droplets from getting into your nose. So although culturally we've had an aversion to wearing masks, certainly if you're sick, you should wear something over your face, get a covering of some type to block the fluid. But just everyone at home can do this. Say the word, stay healthy. When you say that health part, you're actually spitting a little bit. And that's why you need the 6 feet barrier. The problem with cloth masks is it doesn't really protect you as well as you'd like to, and you get a false sense of security. And if you play with it all the time, you actually touch your fingers to your eyes. So that doesn't help you either. So net, it's better than nothing, but not a ton better than nothing.
All right. The threat to doctors by the governor of Michigan has now been reversed on hydroxychloroquine. There was a mandate in Nevada. There was Michigan, too, that you couldn't get it at a pharmacy. The only state left now that is demanding you go to a hospital is New York State. Instead of, if your doctor wants to prescribe off-label with all the anecdotal evidence, you have generously researched and talked to doctors all around the globe, and more evidence comes in, hopeful and so promising to me, as Dr. Hannity, who's not a real doctor. But why? Why are we pushing people into the hospital to use a medicine that is, according to you, I don't want to put words in your mouth, fairly safe and seemingly effective, both anecdotally, and you told us about the study last night, the clinical study?
Well, just to refresh everyone's memory, in China, they have a randomized trial, and everyone says it's very small, but I say the opposite. Even despite the small numbers, they got significantly improved results with reduction of fevers, reduction of the cough, improvement of CT scans showing less pneumonia. I mean, significant, statistically, less than 1 in 100 chance in 2 of those cases that it could just be random. So even with a small number, we're seeing evidence. We need a large trial. Everyone agrees with that. But you go to war with the army you got. And I think most clinicians are getting comfortable with this. I interviewed today Governor Collier from Kansas. He's a practicing doctor now. And he said the same thing. He's using it routinely. He's very happy with the results. Very few side effects, both in the trials and in anecdotal use. But you mentioned earlier, it's the #1 medication. It's inexpensive, available in many places, and used for decades. It's the #1 drug that physicians around the world pick as their top choice to deal with COVID-19. But it's more than that. I've been calling around to different countries. And so if you go to, for example, Turkey, which is where my family's from, the government took all the hydroxychloroquine and it mandates you take it early in the disease. In China, it's in their formulary. Literally, when you get, I got the little book. It says in there, you got to give patients early on this pill. We have evidence from clinical trials that are small now and mixed, by the way. Not all are positive, but everyone seems to think, let's better off give it. I don't want to have government getting in the way of physicians prescribing medications that they think their patients benefit from. The FDA, God bless them, has expedited and made it comfortable for doctors to prescribe a soft label. I don't think we want governors, and thankfully Michigan and Nevada, they pulled back. I do think Governor Cuomo is going to pull back when he thinks about the trials.
Now's the time.
He should have already today.
Lift the ban. Lift it. I mean, you're the only state. Lift the ban. That's what I'm saying. I don't want to put words in your mouth. No, I'm serious. It's like you bring us all this information. You tell us all these countries. You're talking to all these doctors around the world, all these patients you're putting on your show in the afternoon. All right.